friends, this is Dr. Abdequaem Chimthanawala. Once again would like to share a very important case of threatened abortion. I had a lady, she was accompanied by her mother. The mother's complaint were that her child had become very much quiet. She was very jovial, very much volatile, playing pranks, enthusiastic. She liked amusement. Suddenly she has become very quiet. I don't know why. Actually, she wanted to be treated for that complaints, and she was pregnant. And she also told that sometimes there is blood discharge in course of pregnancy, during pregnancy also. So I thought maybe because of a threatened abortion type situation has come, that's why the lady had become very quiet, mild and everything. But the mother was telling that the doctor told her that there is no problem or discharge. It happens in some cases, but it will be fine. Just take care, just take rest. But she was more worried about the nature of her child, that is, she had become very quiet. She was in fact telling me, Doctor, you also can understand a child who is so enthusiastic, jovial, cracks jokes, likes amusement, goes out, is a life in the house. Suddenly she's become very quiet and dull. So asked the child that whether she had fear that it might cause abortion. She said, sir, that is there, but it is not so much severe because the doctors are sure that is okay and that will be fine. But still I feel, I don't know why I have become so much quiet. I said, anything else you want to add to that symptom? And she said, no sir, rest everything is fine, that's all, but this is the only symptom why I feel, I don't know, I am feeling that quietness, and I feel that my child should not suffer because of my nature. This was the only symptom, this was the only condition because of which the patient came to me. And to my utter surprise that I said, okay, I just tried to repetize the case. The only symptom which I took for prescription was quiet disposition, abortion in threatening. Because of threatened abortion, the patient was feeling quiet. So I took that symptom for prescription, and to my utter surprise, there was only one drug in the whole Mater Medica, and that was Trillium pendulum. Now, Trillium pendulum, we have studied that drug in menorrhagia, in menstrual complaint. So I asked this girl, this child, how were your menses when they started, and how is your menstrual flow? And then the whole Trillium pendulum drug picture came out, and her mother told, sir, he has a problem of too much menses, menorrhagia. The menses are very early, they are very profuse. It is like कि बहुत इतने पैड लगते हैं, एक दिन में 4, 5, 6 पैड लग जाए, इतना ब्लड निकल जाता है वो. और थोड़ा भी उसने काम किया ना, उस टाइम पे उसको बहुत ब्लीडिंग का प्रॉब्लम होता था. उसने दवाई करवाया, अभी ठीक है वो. So what is the patient trying to tell us? Menorrhagia, menses too early, too profuse, flooding with fainting, aggravation from least motion. And she had so much pain in that pelvic psychondrosis or pelvic area and the pelvic joint that she had to tie the pelvis because she felt as if that will fall apart. What is the symptom written in the Mater Medica? Falling apart sensation in the sacroiliac psychondrosis. Bandaging tightly ameliorates. In fact, in the whole Mater Medica, if you see, only one drug, and that is Trillium pendulum. And emptiness, a weakness, a faintness feeling, a goneness, hungry feeling with menorrhagia. Only one drug, Trillium pendulum. Of course, I didn't take this symptom for prescription. I took only one symptom, that is quiet disposition, pregnancy, quiet disposition, abortion in threatening, and that was Trillium pendulum. But when he asked the history, the drug matched Trillium pendulum in menstrual complaints. So my advice to you is Remember Trillium pendulum in menstrual complaints where the menses are too early, too profuse, too long lasting, with fainting, flooding with fainting, and falling apart sensation in the sacroiliac hypochondrosis, better by bandaging tightly, and emptiness feeling in the stomach, a goneness feeling, a hungriness feeling with metorrhagia. So, in short, this is about Trillium pendulum. The drug prescribed to that lady was Trillium pendulum 1N single dose, and she got back her nature. The mother was very happy that you brought my child from a state of maybe a quietness to state of which was there before she was pregnant. So this is the magic of homeopathy. It can bring the mental state which was present, that what is Sora, you can get back that Sora, and the patient becomes more lively and more jovial with Trillium pendulum. So Trillium pendulum 1M cured this case. If you like this video, please do share and subscribe. Thank you.